The therapy study is a randomized phase II study conducted at 11 sites around Australia, a 200-patient study, sponsored by the ANZUP Cancer Trials Group, so an investigator-led cooperative group trial, randomized trial comparing lutetium PSMA 617 compared to Cabazitaxel chemotherapy. Lutetium PSMA 617 is a radiolabeled small molecule that binds to prostate-specific membrane antigen, which is overexpressed on prostate cancer cells, enabling delivery of high doses of beta radiation to sites of tumours wherever they are in the body. The lutetium has a 1 millimetre path length and a 7-day half-life. So it's very effective at targeting tumour tissues with limited damage to normal tissues. And this was the first randomised controlled trial, and the primary endpoint was a PSA decline of 50% or more, and that occurred in 66% of men randomised to lutetium PSMA 617 compared to only 37% with Cabazitaxel. That's in our intention to treat analysis. That's a large difference in that primary endpoint. In this presentation, we also reported the radiographic progression-free survival and PSA progression-free survival. Those combined had a hazard ratio of 0.63 favouring lutetium PSMA 617. This difference was most marked at 12 months, where 19% in the lutetium PSMA arm had not progressed compared to 3% in the Cabazitaxel arm. Again, a large difference favouring lutetium PSMA. Now, we're able to assess objective response rates on CT scanning using RESIST, and that was seen in 49% compared to 24% with Cabazitaxel. And importantly, despite these efficacy results, which strongly favour lutetium PSMA, we saw less adverse events and better patient-reported outcomes with lutetium therapy. So grade 3 to 4 adverse events were seen in 33% versus 54%, lower incidence with lutetium. And we did a lot of patient-reported outcomes. And this showed large differences favouring lutetium PSMA with regards to fatigue, diarrhea, hair loss, insomnia, skin rash, sore hands or feet, or urinary symptoms. So the summary of the therapy trial is that lutetium PSMA 617 appears to be a new effective arm of treatment for men with metastatic castration-resistant prostate cancer, and it really appears as promising compared to Cabazitaxel chemotherapy.